Karibuni nyote. Welcome to the National Emergency Response Committee on Coronavirus. This is an update in the country response measures as at 11th April 2020. Dear Kenyans, as at this morning, the global coronavirus statistics indicate that the number of those who have succumbed to the disease is 100,260 people. This number continues to rise. The same applies to the number of those that have so far tested positive for the disease, which currently stands at 1,700,435 people. And this number is very quickly hurtling towards the 2 million mark. Out of this, 480,000 people have recovered. These are our brothers, sisters, fathers, friends, relatives, and loved ones. Fellow Kenyans, when we consider that this weekend marks our 100 days since the first case of COVID-19 disease was reported, we begin to realize that globally we have been losing at least 1,000 persons daily. These are no mean figures, and it is more the reason why we should continue to observe the measures as advised by the government. Fellow Kenyans, we are breaking down these figures so that we can show you in clear terms the danger that is facing us. To relent even just a little in complying with government directives that have been so far been issued is to invite mass deaths. We therefore continue to appeal to you to uphold these measures and to ensure compliance by yourselves and all those around you. We continue to applaud the initiatives by county governments to combat COVID-19 virus. I'm delighted to announce that the number of isolation beds in our country is increasing day by day, thanks to our county governments. We encourage all county governments to continue upscaling capacity at all county health facilities to fight this disease. Once again, I want to acknowledge the contribution of all our healthcare workers for their continued commitment and support in the mitigation efforts in different aspects of health service provision. This is to let you know that we value what you're doing, our dear healthcare workers. I also want to acknowledge the contribution of Kenya Pipeline Company in coordinating the production and distribution of sanitizers. I'm glad to inform the country that so far, 300,000 liters of sanitizers have been produced. This has been sent to various government agencies and the Council of Governors for distribution to the counties. I want to recognize KPC's corporate partners for this venture, and these include Vivo, Kenol Kobil, Total, Ola, Yana, KWAL, NOCK, EABL, BAT, Coca-Cola, Balor, Mattel, and SGR. I'm delighted that with continued receipt of more ethanol through the partners of other government agencies, KPC and its partners is revising the initial target of producing 1 million liters of sanitizer to 2 million liters, and for this we commend them. This will indeed boost the requirement to have as many Kenyans as possible sanitize their hands. I would also like to caution everybody that this is not the time to engage in politics with donations that have been given by well-wishers or corporate entities. Fellow Kenyans, since our last briefing yesterday, we managed to test 491 samples. Out of this number, 2 have tested positive for coronavirus disease, 1 in Mombasa, 1 in Nairobi. This now brings the total to 191 cases of confirmed cases in the country. One of these cases is a Kenyan and the other is a foreign national. None of them has a recent history of travel. The 2 cases were picked by our surveillance teams, and one of these cases is aged 2 years old and the other is 32 years old. A total of 2,054 contacts have so far been monitored, out of which 1,546 have been discharged. A total of 508 contacts are being followed up at the moment. Out of the 191 cases, 109 are male, whereas 82 are female. And in terms of age distribution, 124 are aged between years 30 and 59. 50 cases are aged between 15 and 29 years, and 7 of these cases are aged 60 years and above, while 2 of them are under 2 years of age. Today, 2 more people have been discharged from hospital. Cumulatively, this now brings to 24 the number of Kenyans who have recovered and been discharged from our health facilities. And finally, dear Kenyans, as we continue to celebrate Easter holidays in our homes, let us reflect on what we must do in order to contain the spread of infections. We must remember to wash our hands. We must remember to continue observing social distance. We must continue to wear our face masks, and we must continue to stay at home. I thank you.